Hello everyone, thank you for joining me today. My name is Jolly. I am a doctor of physical therapy, and today will be the first video for the series of plantar fasciitis. Alright, so today we're going to be discussing what is plantar fasciitis. So plantar fascia is a fibrous band that runs on the bottom of the foot here. So it starts at the heel bone here, it fans out, and then inserts all along here. So anytime a stress is placed on the plantar fascia, people tend to feel the pain right in here. So the first signs of plantar fasciitis is that you get pain with initial stepping, especially when you wake up in the morning and you put the foot first down, you're going to feel the pain in the heel. That's most likely plantar fasciitis. Some of the conditions that puts you at more risk of getting plantar fasciitis is if you have a high BMI, if your foot type has either a really high arch or like completely collapsed arch, or your foot kind of goes into pronation, which means that your arch kind of drops down like that, especially when you are walking or doing any sort of weight-bearing activity. And also if your occupation is such that it requires you to stand for a long period of time. So a few years back, a bunch of physical therapists came together and looked at multiple research articles. I think what it was at least over 5,000, maybe close to 6,000 articles they looked at. And then they came out with the best physical therapy clinical guidelines as far as the treatment approach goes for plantar fasciitis. And what they found was that there was strong evidence to suggest 5 different type of treatment plans, okay? So number one, what they discussed was doing some sort of a manual therapy techniques for the plantar fascia and then the calf muscle. And for those of you at home right now, that would pretty much mean doing some sort of a massage technique to break down the scar tissue and improve the mobility in those tissues there. Number 2 was doing a stretching routine for your calf and your plantar fascia muscle, or plantar fascia, it's not a muscle, it's a fibrous band. And then number 3 was wearing a night splint. And so what night splint is, it's just a device that you wear overnight, and it's meant to give you a low grade stretch throughout the nighttime so that when you first put that foot down in the morning, it's not as painful. Most of the time, doctors prescribe night splints to be worn for at least 1 month, maybe 3 months, even up to 6 months for it to show you some improvement, like long-term improvement in your plantar fasciitis. Number 4 thing that they found was taping to be very beneficial, especially during the initial inflammatory stage of plantar fasciitis. Usually taping is used for the first sort of 3 to 4 weeks, and after that you are really trying to do more, soft tissue techniques or exercises so that you get long-term kind of benefits out of it. So the taping, using it for a long time, it does irritate the skin level, but for a short period of time it does help you with the pain. And now what they found was, if number 4, taping is very beneficial for you, or if you find that there's pain reduction, then they recommend orthotics for that person. And the orthotics can be either over the counter or custom orthotics, and those orthotics are really meant to prevent the dropping of the foot, so where the arch is like this in non-weight-bearing position, but most of the time people, as soon as they put their foot down, the arch kind of collapses down. That's called the pronation. So those orthotics were looking at pronation control, and those were found also to be very beneficial. Now don't forget, I will be going in detail as far as these 5 treatment options, so don't forget to subscribe to my channel and check back in to see those videos. Thank you so much for watching. Bye.